Okay, we've all seen it. We've all seen episodes of ER or whatever your favorite hospital show, Grey's Anatomy, where you get those irate patients and there's almost conflict or physical altercations on these episodes. That's drama. That's television. However, things do happen. Things can happen in the emergency room. And so, because we are on the administrative side of healthcare and we're the ones who are welcoming our patients into the emergency room so that they can go back to see the clinical team, we oftentimes need to learn and use these skills of problem solving and conflict resolution. So I'm bringing Phylicia Belfast back to have this conversation. If you are new here and you've not been in this space long, this is Inlera University. In this space, we are committed to alleviating the stress and confusion in the business of healthcare. Today's conversation is an example of the conversations that happen here in this space, which is ways to help our folks in the healthcare system, whether they're in the system already or looking to break into it, but we want them to build the confidence, have access to the resources and the network that's going to help them be successful and improve the delivery of our patient care in the United States. So welcome back, Phylicia. Thank you so much for being here.
Thank you so much for having me back.
So I want you to first share a little bit of your experience. So my folks who are not familiar with you, I want them to understand why this is a relevant conversation for you, one that you are very familiar with as far as emergency room drama in real life, not the television world, and how exactly you learned these skills to help you navigate these difficult patients and volume that happen in our emergency rooms all across the U.S.
Well, I have been in, oh gosh, how long has it been? I've worked in the emergency room for about 10 years. So I've definitely seen a lot of various different aspects of different varieties and scales and severities of conditions, maybe at least 2 or 3 times. I have learned that, of course, in an emergency room, these are the most critical, urgent scenarios that happen. Sometimes they're the most severe, which are, of course, they're going to come with an array of emotions, whether that's, sad or highly, highly upset. The best advice that I learned, and I'm here to tell all of you that have never been that type of high stressful, high volume situation, try your best to remain calm. Make sure that you listen intently to patients, to their family members that come through those doors. Because at the end of the day, right, this is their family member, their loved one that is either in some type of critical stage, which could be a critical life stage, whether they may make it or not survive, depending on the condition. So they need someone to vent to. And I know that as an ER registrar, we try our best to not take it personal, but we try and keep calm. We let people speak. And then we also rely on the support of our team members and our leaders so that we can help our patients stay calm as well.
So great. Yeah, that's one thing that we always have to remember is we are meeting people in their most stressful. It is not, it's not an elective visit to a doctor's office, right? Where we're like, oh, let me just see how my health is. No, there's a situation that is emerging for them that has come out of nowhere in most cases, which is why they found themselves sitting in the emergency room. So you're going to deal with that full spectrum of emotions. And yes, to your point, Phylicia, like this the reality of the situation you have to keep into the forefront of your mind first, knowing that you're not going to get people that are going to be happy go lucky and cheery and kind necessarily, right? They're not necessarily thinking about remaining in those levels of emotions that maybe feel good. And so I think that my first level, like a recommendation would be, is one of the 4 agreements, if you guys aren't familiar with that. And Phylicia, I don't know if you're familiar with it, but one of them is like, don't take it personally. Like it's not about you. So things that come up and people being kind of more abrasive than you would like them to be, a little bit more aggressive than you would like them to be, know that a lot of that has nothing to do with you and even this current moment of time. And even if they're, lobbing words and things at you, the truth is that it doesn't really, it has to do with the situation probably that is causing that frustration, and the pain, the very literal pain or stress in the moment. So my first point of advice would be to say, don't take things personally. And Phylicia, I would love to hear more from you because you're the ones with the hands-on knowledge in ER. I did very little in the emergency room, and that was back when I was volunteering at the hospital, and I would make rounds and spend a little bit of my day, a small window of my day in the emergency room because I was delivering mail there. That was literally the extent of my experience in the emergency room. So I will let the expert continue to speak and share on this.
And just so you know, Jasmine, you still actually got to see a lot of different things, even just delivering mail in the ER, because you still get to kind of network and chat with people and see how things still flow. But yes, in an emergency room, let's understand. And I've also worked in the trauma unit within the emergency room, which is the most critical conditions, which are normally the patients that are getting helicoptered in, whether that is from a different state or they're getting helicoptered out for various reasons. That maybe that at that setting, maybe at that facility or healthcare system you work at, does not have the capacity to care for that type of condition. However, these are patients that are upset. They're sad. Normally, when patients are ill or worried, scared, frantic, emotions will naturally occur, right? I'm sure if you fell on you and you scraped your knee, what's normally the kind of the first face or expression that someone will kind of naturally make is like, ow, oh my God, I'm hurt. And that's imagine someone 10 times worse of a condition that's happening. So it's not personal. It's not directed at you. Patients don't come in to attack anyone for any reason. They're just coming in for information. And most importantly, to know that their loved one or themselves are safe and healthy and that they can go home the next day. So definitely rely on your team. Definitely understand that it's not about you and just remain calm. Sometimes you don't have to say anything to someone. Maybe they just need to vent to someone to get that weight off of their chest. And it's great that you're that person as an ER registrar to have that type of support for patients in that type of aspect because they need it. So you play a huge valuable role for people and their emotional state.
Oh, I love that. That's really, really great advice and consideration. So, if someone is starting in this kind of role and they don't have a lot of experience in, we'll call this effective communication, right? I mean, like even an effective listening skills specifically, right? Is that something that oftentimes you see the emergency rooms training the team in?
Oh, absolutely. So, working in the emergency room, we will give you, of course, tips, advice, feedback, how to kind of respond in different various scenarios. But in an emergency room, things that are urgent, you can't necessarily always prepare for everything that walks into the door, which is why the emergency room and pretty much every healthcare department is structured in a way where it's a team unit. You're not by yourself because you will have ample support, whether that's administrative or that's clinical, to help support that entire situation or occurrence that might happen that might be something that you can't handle on your own.
So good. So good. Yeah, I'm so interested to learn ways that folks can kind of do things like first conversate and community. I think is important, right? So it's all about hearing other people's experience like Phylicia's and learning the ways that they problem solved and how they navigated those difficult situations. But I also love the idea of role playing, and these are things that we are exploring and kind of talking through what this could look like in our community. So if you're new here, this is Inlera University. We have folks here in all areas of the business of healthcare, really the backbone of our healthcare system. And so we support folks in their learning and their journey, but especially in the networking and the community aspect and really getting people with folks in their sector so that they can learn from each other, right? So there is an opportunity for our folks in the emergency room to help illuminate for the newbies, we'll say, the ways that they kind of worked through the challenging situations and helped themselves, be more in a place of confidence. And so, what I'd love to explore, and wondering if you guys kind of have some input in this, my folks out there, is if you would let us know, like, what feels better, more supportive for you in your journey. Would you want us to offer these opportunities like role play sessions, or ways that you can network specifically with folks in different departments of the healthcare system? Because I see that could really serve. I see how that could really serve the folks that are coming into this industry and or trying to just build more confidence to move into a leadership role, right? Because sometimes when you've worked in a very specific area for a long period, you may not have been fully exposed to other aspects, and this kind of conversation with other folks that might be in kind of an adjunct area, or something somewhat adjacent to your role, but you've never actually had a chance to understand what they do. This could help illuminate for you what that individual does. And when you have that knowledge of kind of the full scope of the practice of the healthcare environment, it can really help to lend the possibility of you actually developing as a leader, because you know more, right? And when you know more, you could potentially do more and be more creative in your thinking. So, Phylicia, that just dropped in for me. So I don't, excuse me,
Perfect.
that just dropped in for me. I'm very curious about how that lands for you, and what your thoughts are on the possibilities there for the community.
No, I love that idea. Definitely. Let us know what it is that you need, right? Some people are visual learners, myself included, right? If you need that type of advice, that type of real world scenarios that I've actually experienced tons and tons and tons of times, I'm more than happy to kind of help you guys in the community. So tell us what is that we can do to help you be successful in whatever role that is within healthcare.
Love that. All right, friends. So this is a conversation that we are having around the emergency room. We're going to continue these conversations. So make sure that you stay connected to us. Hit that like button, give us the thumbs up, and make sure you hit subscribe and that notification bell, because it will let you know when we have these new videos that post, as well as notify you when we schedule premieres, which is when our new videos are going to go up, and when we go live. So YouTube does a great job at keeping you in the know, and we want to make sure you get this fresh information as it releases. So, and if you're interested in getting deeply connected to our community, we have memberships both here on YouTube as well as on our space. So it's important that you learn about those things so that you can start to explore the possibilities for yourself in this new field of healthcare. So thank you all so much for being here, Phylicia. Appreciate you.